Moving into the capillary pressures from the arterial pressures, you'll notice the capillary pressure is typically lower than the arterial pressure. Now, the capillary pressure could range anywhere from 15 to 35 millimeters of mercury. There's a range there. You usually want to be on the lower side. There's two reasons. One, if the pressure is too high, there's a chance of rupturing the capillary. You definitely don't want to do that. But two, lower pressure actually helps force more filtrate into the interstitial space. Because lower pressure means the blood's flowing a little bit slower, giving more chance for things to get out. If it's going too quick, it just simply bypasses all the passages and it just goes right through. So you want to have on the lower pressure side in the capillaries. But the trick is you don't want too low. Anything lower than this 15 millimeters of mercury could be problematic. Not because of the capillaries, because of what comes after. We'll get to that in a second. So capillaries, lower pressure, remember those arterials had a high amount of resistance. So they dropped the pressure down from that high pressure arterial system. Now the reason we want to have at least 15 millimeters of mercury of pressure though, is because of the venous system, the venules. The venous blood flow has to go from the capillaries back to the heart. Now, 15 millimeters of mercury isn't a whole lot of a pressure gradient. That's not much pressure. But that's enough to get it back up to the heart. Anything lower than that might not be enough pressure to get your blood back to your heart. The blood might start pooling and collecting more in the veins. Now, this small pressure gradient, this 15 millimeters of mercury pressure gradient, thankfully is enough because there are a lot of other helping factors I'll get to. There'll be three main helping factors to get blood back to your heart in addition to this pressure. But the reason it's so low is because of all the cumulative effects of all the peripheral resistance. Those big elastic arteries, they still had resistance. The muscular arteries still had a resistance. The arterioles had a whole lot of resistance. Capillaries, a little bit of resistance. Now we're back in the veins. So all that led up to this low pressure system. So the entire venous return, doesn't matter if it's your foot, your head, your arm, your torso, it's all a low pressure return back to the heart. By the time you get into that right atrium, the pressure is zero. Because you've simply exhausted all the pressure, dump into an open cavity, which means that there's zero pressure. So the three factors, or the three main factors that help return venous blood. First up is this respiratory pump. Now, the respiratory pump, like the name implies, respiratory, lungs, every time you breathe, you're changing the pressure inside your thoracic cavity, which means the blood that's flowing up the inferior vena cava here, for example, is helping to be pulled up because of pressure changes. So it's aiding in getting blood back to the heart. Muscular pump. Now, again, like the name implies, the muscles are a pump. What's happening here is the blood is kind of being squeezed and pushed up by the muscles. So if you look over here at the relaxed muscle, you'll notice the vein in between is open, has space. The valve is preventing the backflow. But once the muscle starts to contract, remember as muscles contract, they shorten and get wider. So in this case, you'll see that both pushed inwards, pinching that vein. Well, the blood can't go down because of that valve. So instead, what happens is the blood can only go up through the open valve. So this muscular pump, mostly in the arms and legs, the limbs, is helping to push blood up through the veins. And the third factor you're looking at is vasoconstriction. Sometimes it's called venoconstriction because it's in the veins. But there can still be a little bit of vasoconstriction from the sympathetic control. So your body can tell your veins just a little bit to contract. Now they can't do nearly as much as the arteries because they don't have the same amount of smooth muscle. But they can contract a little bit to try to help out with pressure generation by squeezing a little bit what's there. And of course, don't forget, the veins have large lumens, which helps to reduce resistance. So 3 factors that helped out the veins, in addition to the large lumens, as well as about the capillary pressure there.